Hello, everyone. My name is Barbara Dondero, and I'm the school district nurse for St. Helena Unified School District. I'm really happy to be here this evening to talk to all of you parents about some of the things that we are doing here at St. Helena Unified to keep your student and keep our staffs healthy and safe when we open next Monday in person. And some of the things that you can be doing at home to help us with your child, and things that you can remind them to do and go over with them before we come back to school. Okay, so I'm going to share a PowerPoint presentation with you. Okay, so hopefully you can all see that. Okay, so I'm sorry, I'm going to minimize this. Okay, so this is some parent education about COVID-19 for you and your student. This is following the California Department of Education, California Department of Public Health, and Napa County Office of Education guidelines. Okay, so here's some important things. This is a lot of information, but these are some of the important things about coming back to school in person. The number one thing is to keep your child home when they are sick or if they have been exposed to someone with COVID-19. We want everyone to do a health self-check at home in the morning of your student, and we're asking all of the staff to do this too, which includes taking their temperature, checking them for symptoms, and also checking them to make sure they haven't been exposed to anyone with COVID-19 in the last 14 days. I'm going to go over the symptoms of COVID with you, although you're probably all very familiar with them by this point. I'm going to go over a little bit about face coverings and what we're doing at school with that, physical distancing and how we're enforcing that at school, hand washing and hand hygiene, respiratory etiquette, and what we're doing here at St. Helena Unified School District to keep the students safe and healthy. I just put this reminder in right here at the beginning so that everyone knows to please maintain and update your contact information in case that your child needs to go home, that we will be able to contact you in a timely manner. Thank you. We want everyone to know that we're in a partnership together with you, and we all have the same goal, which is keeping students and staff healthy and safe and being able to have school in person, because we know that that is the best thing for our students. So we're asking you to perform the health self-checker every morning. Sometimes people call it a self-checker or self-screening. All of our staff are doing this. And this has been shown to be an effective way to prevent the spread of COVID-19. So that includes a temperature check and a check for symptoms of COVID-19 before coming to school. We ask you not to send your students to school if they have any symptoms of COVID-19. Please call the school office and let them know what your child's symptoms are and that you will be keeping them home for the day. And the good thing is that since we do have remote learning or distance learning going on at the same time that we have in-person learning, your child, if they're feeling well enough, will not have to miss their class or their lessons. Of course, if they're not feeling well, we want you to make sure that they rest and not do too much so they can get better. So if they feel well enough to participate, they can attend class virtually when they're home. These are the health screening questions that are recommended by Napa County Office of Education and Napa County Public Health. This is what we ask you to do every morning. Answer the 3 following questions. And this refers to your child or student. Are they experiencing or have they experienced in the last 72 hours any COVID-19 symptoms? If they have, we ask you to keep them home. Is anyone in your home experiencing any COVID-19 symptoms? If yes, then we would like you to keep your child and student home to protect their health and ours. And if your student or child has had contact with someone diagnosed with COVID-19 in the past 14 days, we would like you to keep them home. And the reason for the 14 days is that is the recommended quarantine time period, based on that it can take up to 14 days to develop COVID-19 after you have been exposed. The time frame for students to come back to school after they have had any of these symptoms it's a minimum of 10 days. And we realize this is long, and hopefully this will not have to be enforced too often. But the CDC is recommending this, the California Department of Public Health is recommending this, and so we need to follow their guidelines. So the first day of symptoms counts as day 1, and then you have to wait at least 10 days after the first day of the symptoms before your student or child can return to school. They have to have no fever for at least 24 hours before they return to school if they've been sick. And this is without the use of Tylenol or ibuprofen or another fever-reducing medication. And then also their other symptoms have improved, and that would be the things like coughing or congestion. Those have to be improving or improved. And then in this little blue box on the screen, you can see the list of common symptoms of COVID-19: cough, shortness of breath, a fever of 100.4 or higher, sore throat, chills, headache, runny nose or congestion, nausea, vomiting, diarrhea, and loss of taste or smell. And that last one is rather a unique symptom of COVID-19. There's not very many acute illnesses or any that I know of that have that same symptom. But the other ones, as you know, are really broad and very common symptoms of colds and flus. So it is difficult to determine which illness that is. But still, we need to follow the guidelines for COVID-19. Okay, so the symptoms of COVID-19 can appear up to 14 days, as I said, after exposure. And generally, it's 2 to 14 days after exposure, and the average is 5 to 6 days. And as you know, people can have a range of symptoms anywhere from mild to severe. And of course, a few people do die from COVID. That is usually people with underlying health conditions or people who are quite a bit older. But many people with COVID-19 have no symptoms at all. And that's what's called asymptomatic. But those people will test positive to COVID-19, and they can spread the virus to others. And as well, people who develop COVID-19 but don't have any symptoms yet can spread the disease to other people. So typically they think about 2 days before you would test positive or develop symptoms, you are contagious to COVID-19. Okay, again, this is just a graphic of some pictures of the common symptoms of COVID-19. Cough is one of the most common, the fever, chills, muscles, body aches, vomiting, diarrhea, nausea, new loss of taste or smell. Those are the most common, but then also there's sore throat, headache, runny nose and congestion, and nausea. The recommended temperature for a definition of fever is 100.4 Fahrenheit or higher. And the reason that they use this term unexplained is because sometimes we know, for those of us, say, who have allergies, which are really common in Napa Valley, and maybe your student or child has a runny nose or congestion, and if you know they have allergies, then we will take that into consideration and not assume that it's COVID. Okay, physical distancing. We're doing a lot here, and I'm sure you're all very familiar with this now, but we're doing a lot here at St. Helena to create an environment that supports physical distancing. So as you know, 6 feet apart is physical distancing. We've been able to arrange almost all of our classrooms and all of our spaces to commit to the 6-foot distance between students and teachers and students and students. We have a staggered arrival and departure times. We have designated specific entry and exit points. We have a lot of signage and arrows and signage on the floor, stickers on the floor for students to follow. We've have arranged our classrooms to promote 6 feet of distance whenever it's possible. We've minimized and mostly eliminated crowds of people here, of course, and we've created guidelines to enable physical distancing when students are passing. Fortunately here, most of our campuses are open, so most of the passing is outdoors, so we have a lot of space as opposed to schools that have indoor hallways. And we're going to be doing everything we can to educate the students to follow these guidelines and encourage them to continue doing that. Face covering. So the face covering guidelines these are from the California Department of Public Health for schools. So they face coverings. Well, actually, this is the general one too. Unless a person is exempt from wearing a face covering, everyone needs to wear them when they're indoors, when they're on school buses, and where physical distancing is not possible. So because there's so many times you need to wear a face covering, I'm just going to go over the actual exemptions. So for children under 2 years old, because of the risk of suffocation, people who are hearing impaired, or if you are communicating with someone who's hearing impaired who may need to read lips to assist in their communication, then it's not absolutely required to wear one. Anyone who cannot remove the mask by themselves for developmental reasons or medical or mental health reasons does not have to wear a mask. And then when you're outdoors, either playing or working, and if you're able to stay 6 feet apart or greater, then you do not need to keep your mask on. And then also the one caveat, if you are able to stay 6 feet apart, even if you are indoors, if you're eating and drinking, because obviously, as we know, that's difficult to do with a mask on. Face covering requirements in educational settings per the California Department of Education. So as I said, under 2, not required. Ages 2 years old to 2nd grade, the state guidelines are strongly encouraged. And in Napa County Public Health and Department of and Office of Education and St. Helena School District have decided that our students from K through 2 are able to wear masks, and we're going to be doing that because it's so protective from spreading COVID-19. 3rd grade through high school will be wearing masks, and of course our staff are required to wear masks. I have to stop sharing my screen for 1 second, and because I did forget to do something, and even though I put a Post-it here to remind myself, I did forget. So here we are again. Okay, so face coverings in schools. So this is a really nice graphic from CDC. And most people are using cloth face coverings, and that's completely acceptable and very safe. They should have at least 2 layers of fabric. Of course, it should be washable and breathable. The mask should completely cover your nose and mouth and fit snugly against the sides of your face so that there are not air gaps. That's the most protective. And as you probably know, the masks that we wear protect ourselves and others. They're mostly used to protect others. So you wear your mask and that protects me, and my wearing my mask protects you. There are a few kinds of masks that aren't very helpful and protective that we don't recommend and will not be allowing at school. Of course, you wouldn't wear a mask that was made out of something vinyl or that was not breathable, because you wouldn't be able to breathe through it. The masks that have exhalation valves or vents, sometimes you see them in the N95 masks. We all have used them in the past with the smoke in the air, or now they are making cloth masks with the vents. Those allow the virus particles to escape. So when the wearer has them on, the potential virus and respiratory droplets from the person wearing that mask with a valve, they can get out of that valve. They do make it easier to breathe for people who have asthma or things like that, but they're not protective of the other people in the community. So we can't allow them at school, because we all need to be wearing the masks to protect each other and ourselves. Okay, and then N95s are not recommended. If it's an N95 without a valve or a surgical mask, you certainly could wear it, but it's recommended that they're saved for healthcare workers. because there is a shortage. We do have extra cloth masks and surgical masks here at school if your student ever forgets their mask or if they want to use ours. And we do recommend, I didn't want to go too much into, but we recommend that you wash your cloth mask every night. And it can be washed by hand or in the washing machine on the hottest water that it will tolerate, and then to dry in the dryer, also on high heat, or dry it in the sun. Okay, so here's a couple of short videos. This one, first I'll show the one in English and then in Spanish about how to wear and take care of a cloth face covering.
It's important to wear cloth face coverings when you're out in public and around people who don't live in your household. Face coverings act as a barrier to help slow or reduce the spread of COVID-19. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Fit it snugly against the sides of your face, but make sure you can breathe easily. Don't put the face covering around your neck or on your forehead, and don't touch it. If you do, wash your hands. Never share or swap face coverings. When you get home, carefully take off your face covering by stretching the ear loops or untying the strings behind your head. Fold the outside corners together and put it aside for washing. Then wash your hands. Cloth face coverings should be washed and dried after use each day. Label your face covering with your name or initials. Bring a backup in case it's needed. In addition to wearing cloth face coverings, remember to follow everyday healthy habits. Wash your hands often, stay 6 feet away from others, and stay home if you're sick. If you have any questions about wearing a face covering at school, contact your school nurse, a trusted resource for students, parents, and staff.
Okay, now we'll watch the same video. Oops. I'm sorry. This is supposed to be the Spanish one. Yes.
Es importante usar una cubierta de tela para la cara cuando se encuentre en lugares públicos rodeado de personas que no viven en su hogar. Cubiertas de tela para la cara actúan como una barrera para ayudar a desacelerar o reducir la propagación del COVID-19. Consulte con su escuela para información sobre las políticas de las cubiertas de tela para la cara. Lávese las manos antes de ponerse su cubierta de tela para la cara. Colóquela de tal manera que le cubra la nariz y la boca y asegúrela por debajo de la barbilla. Ajústela a los lados de la cara, pero asegúrese de poder respirar con facilidad. No coloque la cubierta de tela para la cara alrededor del cuello ni sobre la frente y no la toque. En caso de hacerlo, lávese las manos. Nunca comparta ni intercambie las cubiertas de tela para la cara. Cuando llegue a casa, quítese la cubierta de tela para la cara con cuidado, estirando las bandas elásticas de las orejas o desatando las tiras detrás de la cabeza. Doble las esquinas exteriores juntas y apártelas para lavar. Luego, lávese las manos. Las cubiertas de tela para la cara deberían lavarse y secarse después de uso cada día. Etiqueta su cubierta de tela para la cara con su nombre o sus iniciales. Traiga otra cubierta de tela para la cara en caso de que sea necesario usarla. Además de usar cubiertas de tela para la cara, recuerde seguir estos hábitos de salud cotidianos. Lávese las manos con frecuencia, manténgase al menos 6 pies de distancia entre usted y los demás y quédese en casa si está enfermo. Si tiene alguna pregunta sobre las cubiertas de tela para la cara en la escuela, consulte a su enfermera escolar, un recurso confiable para estudiantes, padres y personal.
All right, I hope that was helpful. Wash your hands, and wash your hands. As you know, wash your hands frequently. Whenever you think about washing your hands, go ahead and do it if you can. If you can't remember the last time in the day that you washed your hands, it's a good idea to go do it again. I think most of you are familiar with this now, but the basic concepts of washing your hands are wet your hands first with running water, apply soap, and lather really well. You want to make sure you get all sides of your hands, between your fingers, on the backs of your hands, your wrists, your thumbs, and the tips of your fingers. You want to scrub for at least 20 seconds, which is singing the happy birthday song twice, which does take a while to do. And if that's not a fun song for you, think of another song that lasts about 20 seconds to help you remember to wash your hands that long. Make sure you rinse them well and then dry your hands on a clean towel, or you can air dry them. If you don't have access to soap and water, or soap and water is always the best, but if you're in a rush or you don't have access to soap and water, then you can use hand sanitizer, and it needs to be at least 60% ethyl alcohol in order to kill COVID-19. And I think you probably all know, but the general times that you need to wash your hands are before and after preparing food, before and after eating, before and after using the bathroom, after anytime you've dealt with animal cleaning up or feeding an animal or petting an animal. And we're going to have everyone wash their hands when they arrive here at school with hand sanitizer. And then it's best if you wash your hands when you get home from school or from the public. Respiratory etiquette. This is a new phrase that's become more common. And basically it means these few things. We want to all remember not to touch our faces. Don't touch our eyes, our noses, or our mouths. And that includes when you have your face covering on, to not touch the face covering, as they mentioned in the videos. The other thing is to cover our coughs and sneezes, because that is the respiratory droplets that come out of our mouths and noses contain COVID-19 and other viruses like the flu and cold viruses. So now it's recommended that when we sneeze or cough that we use a tissue, of course, if you don't have a mask on. If you had your mask on, and you sneezed or coughed into your mask, then the best thing would be to go and replace your mask, put that one away wherever you store the dirty masks before you wash them, and then to put a new mask on. If you don't have a tissue, they are saying that you could still use your elbow, especially if you have a sleeve, if you didn't have a tissue with you. And then of course, wash your hands after coughing, sneezing, or blowing your nose. Okay, I wanted to let you know a few of the things that we're doing here at St. Helena Unified School District to help keep everyone safe and healthy on campus. We have new air filters and air scrubbers on all of our campuses, because it has been shown that the more often and completely that air is filtered, the less likely it is for us to be exposed to COVID-19 and other viruses and bacteria in the air. So that is really helpful. As you all know, it's safer to be outside. So that is a similar kind of concept, that when you're inside in a closed-in area without good filters and without good air exchange, it does increase your chances of getting COVID-19. So we're so fortunate here that we have some really good technology and new systems here to help keep the air inside as clean as possible. Of course, we're all doing everything we can to enhance hand hygiene. We have extra sinks placed in many places around our campuses, and we have hand sanitizer everywhere you go, so that this will encourage and make it much more accessible for students and staff to wash their hands on a regular basis. Everyone will be screening their students, and staff will be screening ourselves before we come to school every morning. That is a huge way that we can help prevent the spread of COVID-19. All the students will have their temperature taken with a touchless thermometer when they arrive at school. So this will either be when they arrive to their regular class, if they're in K through 5, or when they arrive to their first period, if they're in middle school or high school. As I mentioned, we're following physical distancing guidelines. We have a lot of things set up here in order to promote and follow those guidelines. We're following the mask guidelines, as I mentioned. All students and all staff will be wearing masks unless they have a reason to be exempt. And some more things we're doing. We have a lot of signage and reminders posted all over on the floors, on the doors, on the walls to help all of us remember what to do and how to do it in order to stay safe on campus. We have an isolation area set up at each school so that, and then someone is staffing that, someone who's trained by the nurse and overseen by myself. And we will have sick students go there until they can be picked up. And so the idea is to keep them away from other students and staff if they're ill with COVID-19. We're doing a lot of enhanced cleaning and disinfecting, and we have been doing that since the beginning of the COVID pandemic, starting in March. So everyone is on board and helping out with this, all of our staff, and of course our custodians who've been doing a tremendous job. We have an additional RN that has been hired to help with employee testing, COVID testing, and with contact tracing. And we have a team of contact tracers here. We have one at each school site, as well as Nurse Brandon and myself, Nurse Barbara. And we're working with the Napa County Public Health nurses to trace if we have any cases of COVID-19 or any exposures to COVID-19. And we're following all the guidelines of Napa County Public Health for quarantine, isolation, and if needed, closing of the cohorts of classes if needed. And that will be, of course, with the guidance of Napa County Public Health. And I think that's it. We appreciate you so much. We're so excited to have your children back in person. This is why we do this work, is because we love being around children and we love working with children. So we miss all your children, we miss all of you, and we're super excited that we'll be back on Monday. And we appreciate everything you do to keep your children safe and everything you do to enforce these educational things that will help prevent the spread of COVID in our community. So we're all in this together, everyone has their part, and we really appreciate the partnership that we have with you. Thank you. Hope to see you soon.